Hello everyone, my name is Dr. Hussain Abbas Chil. I am a dentist by profession and done my masters in conservative dentistry and endodontics. I currently practice in Dr. Chil's dental specialty in South Mumbai. I hope everyone is taking good care of themselves during this COVID-19 period. Many dentists have started their practice or are thinking of starting soon. Hence, I have made a small presentation on the 12 must-have before restarting the dental clinic in COVID-19 times. And these 12 must-have are all non-consumable in nature. So let's begin my presentation. The non-consumable list are as follows: electric dental handpiece motor, Class B autoclave, ultrasonic instrument cleaner, extraoral suction, HEPA F purifiers, UV light trolley, UV tube lights, aerosol protection dome, infrared thermometer, fumigators, foggers, pulse oximeter, health term professional indemnity insurance policy. Electric dental handpiece motors are an alternative to air turbine powered handpieces motors. Electric handpieces utilize an electric motor to create the rotation and cutting motion of the burrs. High torque RPM speed ranges from 100 to 4 lakh. They provide a consistent torque that does not decrease with resistance and higher load. It also tends to produce a smoother and more precise cutting edge due to the stable speed. Class B autoclave removes the air inside the chamber through the use of a vacuum pump, creating a negative pressure that forces the steam entry. They can sterilize porous instruments with drying holes and textile loads, so they are the autoclaves indicated for a dental clinic. Ultrasonic instrument cleaners. Ultrasonic cleaners remove saliva and other biological materials from the dental instruments by the process called cavitation. It uses sound waves to create thousands of bubbles which increase in size until they burst. Ultrasonic cleaning kills bacteria and other pathogens through physical means rather than by a chemical reaction, eliminating the need of harsh compounds and the possibility of instigating resistant organisms. Extraoral suction devices. Extraoral suction devices remove the aerosol which are produced by handpieces and ultrasonic scalers to prevent cross-infection between the dentist and the patient. Studies have shown that a combined use of intraoral and extraoral suction devices result in lower level of aerosol and bacterial colony, suggesting the benefit of installing an extraoral suction device for aerosol reduction during dental treatment. HEPA filters. HEPA stands for High Efficiency Particulate Air. Medical grade HEPA filters offer the highest level of efficiency, a minimum capture of 99.99% of particulates at zero point 0.3 microns in size and larger. HEPA filters will remove ultrafine particles from the air. UV light trolley and UV tube lights. According to the CIE classification, the UV spectrum is subdivided into three bands: UVA, UVB, and UVC. UVC is used mostly in our dentistry. The high efficiency from shortwave UVC light is absorbed in the cellular RNA and DNA, damaging nucleic acid and preventing microorganisms from infecting and reproducing. The pros for UV sterilization are: it is convenient to use and no chemicals are needed. Therefore, no chemical residue is left behind. It is able to kill all kinds of microorganisms, including drug-resistant bacteria, fungi, virus, spores. Coming to cons for UV sterilization, UVC is dangerous to humans. Remember to avoid direct exposure to UVC, especially skins and eyes. UV only works in its light part and can be blocked by the objects. Make sure that the object you want to sterilize is kept directly in line with the UV light. You can minimize this issue by using multiple UV bulbs to generate UV irradiation from different angles. Aerosol Protection Dome. Aerosol Protection Dome is a four-legged acrylic device which is placed above the patient's head as shown in the picture. It is covered fully with disposable cellophane sheets. Slits are made by scissors on sides for dentists and assistants to operate. Aerosol protection dome helps in blocking the aerosol droplets, hence allowing the dentist to safely accessing the patient. Infrared thermometer. Infrared thermometer is a device that measures the temperature of whatever the gun is pointed. Most temperature guns are capable of switching between Celsius and Fahrenheit. Handheld infrared thermometers typically use a lens to focus light from one object onto the detector called thermopile. The thermopile absorbs the infrared radiation and turns it into heat. Fumigators. Fumigators use formalin and formaldehyde vapors. The vapors rupture the cell wall and typically kill inactive bacteria and viruses. The advantages are it is time-tested procedure and it is inexpensive. While coming to the disadvantages, it is noisy, time-consuming, vapors are caustic and potentially carcinogenic, needs trained staff to run it correctly, cannot be used after every patient. Once fumigation is started, the room is not usable for typical 8 to 10 hours. Foggers. Foggers are typical vapors generating devices by heat and spreads by convection current. It uses hydrogen peroxide vapors which are spread into the room and the vapor oxidizes the surfaces and thereby any surface contaminates like bacteria and viruses on the surface are killed or inactivated. Coming to the disadvantages, it is extremely loud, leaves surface visible moist. Droplets are formed on the floor that needs mopping. Moisture is a large particle in nature, therefore all operating room electronics need to be converted with a barrier film before every use. The HPV corrodes surfaces, all dental chairs, equipments and powder coated metallic and plastics will fade in color and lose its sheen. Submicron dry fogging. Instead of heat, it uses sound energy to break particles into submicron size and dispatches it into the clinic atmosphere using small but powerful low energy fans. The advantages of the submicron dry fogging is that practically less sound on running. Dry fog does not need electronics to be covered and it needs no mopping as it is completely dry. Pulse oximeter. A pulse oximeter is a small, lightweight device used to monitor the amount of oxygen carried in the body. This non-invasive tool attaches painlessly to your fingertip, sending two wavelengths of light through the finger to measure your pulse rate and how much oxygen is in your system. A normal pulse oximeter oxygen level reading is between 95% and 100%, and anything less than 90% is considered dangerously low or hypoxic. Some doctors have reported COVID-19 patients entering the hospital with oxygen levels at 50% or below. Health Term Professional Indemnity Insurance Policy. As per guidelines issued by the Insurance Regulatory and Development Authority of India, all claims related with the COVID-19 treatment, including the quarantine period, will be liable to get the coverage under a standard health plan. It will be there to assist the insured with the normal cover on hospitalization for any viral infection, including coronavirus. All the features that you get under your chosen health insurance plan will be applicable to COVID-19 treatment as well. However, in order to avail the treatment through your medical insurance, you need to be hospitalized for at least 24 hours. During your hospitalization, all your expenses will be covered for treatment of the alignment, including pre and post hospitalization expenses. Term insurance policy is a type of life insurance policy that provides coverage for a certain period of time or a specified term of years if the insured dies during the time period specified in the policy and the policy is active or in force, a death benefit will be paid. Professional indemnity insurance protects professionals against claim of negligence or breach of duty made by a client as a result of receiving professional services. Thank you.